Okay.
All right, everyone. It's Russ Johns here and Marion LaSalle, and we have Healthcare Peace of Mind with Steve Baker. Steve Baker is a specialist in Medicare and helping people that are looking for Medicare, or if they have Medicare, they actually searching for options on their coverage. So, Steve, how are you doing today?
Doing terrific. Feeling good.
I like to hear that. I like to hear that. So, so tell us a little bit about what's going on in your world today, and how you're helping others out there in the marketplace, and saving and helping them, educating them on insurance.
Sure. Well, what we've talked about, for a long time, the various kinds of treatments. I mean, the various kinds of Medicare supplements that are out there, and the Advantage of plan as opposed to traditional Medicare with a supplement.
Mm-hmm.
And I was just reading this morning about evolving kinds of treatments, sophisticated kinds of treatments. For example, here in Texas, especially around the Houston area, there's a place called MD Anderson. It's comparable to Sloan Kettering up in New York.
Mm.
There's 4, 5, or 6 places that are really, really top notch, and people come here.
All over the world.
Yeah,
come from all over the world here.
That's right.
And about 5 or 6 years ago, they started something. They built a whole nother plant on their campus for something that's called proton therapy. And I can't begin to explain the procedures beside it, but for many years we've said cut, burn, or poison as far as cancer.
Yeah.
And cut being surgery, burn means radiation, and poison means chemotherapy.
Oh.
And to one degree or another, that's the farm has been taken for forever on cancer treatment. But the proton therapy is something different, and it's highly sophisticated, and it will only work on certain kinds of cancer, but I understand it's quite successful. So a lot of the group plans have not kept up with that, and if someone is 65 and can qualify for Part A and B of Medicare, for something like that, they need to take advantage of getting out of the group plan and going on to Medicare, because Medicare will pay for that. The Part B will pay for that.
Really?
Yeah.
Yeah.
So
How is a person supposed to know about this, Steve? Do they have to know someone like you who will educate them, or does Medicare, or does the employer? Who's responsible, if anybody?
Honestly, it's a mixture of everything. It's just it's just a happenstance for someone to even be in that situation to start with.
Yeah.
And then all of a sudden discover that their group policy won't pay for that. And then they're saying, oh my God, what are my options? And if they're over 65, someone somewhere, the treatment facility, the provider, or someone, the social worker at the hospital, or someone will tell them, you can get on Medicare and it'll pay for it. I guess more than likely, if someone like me, years ahead of time wouldn't cover that with someone,
Right.
Or the group insurance provider would not cover it with them. So social workers are kind of a forgotten area in hospital situations, such as Texas Children's or
Right.
MD Anderson or many other places. The social worker there helps guide people who are in a panic about certain directions. And I suspect most of the time it's picked up by the social worker. That's what I'm thinking.
Okay.
And it is kind of one of those items that falls a little bit in the cracks, right? I mean,
Right.
not traditionally mentioned, discussed. So
Yeah. In fact, to be honest with you, I didn't know it until I read it this morning. I was reading some stuff on Medicare and happened to run across that, and I'm going, oh my.
Well,
Maybe I would like to talk about that this evening.
Yeah.
well, that's a great idea, because one of two things is, we want to mention that you're a specialist because you read up on these things, because
Right.
you stay current on these events
That's
and
right.
some of the
Right.
things that are taking place. Not everybody does that. And
right.
so, one of the things that you do that really impresses me all the time over and over again is your depth of knowledge on the subject and some of the things that people need to consider that I've never thought about. What about you, Marion?
Oh, absolutely. When we started talking about traveling and whether or not you're covered under Medicare, especially if you're on a cruise, I mean, I just find it all fascinating, all the information that you have, Steve. Literally, if you don't have the information for them, I know you're going to go and research it and find out, because that's the kind of guy that you are.
Sure.
And somebody
Yeah.
has the information, and you're probably the one that would find it quickest because you've tapped into so many different resources over time.
Mm-hmm.
I have to imagine that's the case. So,
Sure.
what's the relationship now with some of the the healthcare standards and some of the things that are going on in healthcare? How reactive or responsive are the insurance companies to a lot of these new procedures that are coming out? And I anticipate that these procedures are going to continue to accelerate with technology and everything that's going into it. So I'm kind of curious to what your thoughts are about how we can keep up in the insurance industry with that.
Yeah, well, the insurance industry is not. I wouldn't use the word. It's a little strong to say they're in a stage of upheaval, but I'm going to say, let me say, strong change.
Very good. I like that.
There's a lot of industry being disrupted right now, and that is one of them.
Exactly.
Yeah.
Yes. That's definitely one of them. So they're trying to figure out. Primarily, you got to understand that we live and we've gotten used to, and we grew up in a capitalist society, and by capitalist, that means that as far as an insurance company, their number one goal is to make a profit. They have to make a profit to stay in business, so they can pay their claims. If they can't, they're out of business, and guess what? No one gets insurance. So they have to maintain a profit. And then the government groups come in, from the outside, and they'll say, "We'll do this and change this and develop this," and we will subsidize. And then all of a sudden they say, "Okay, that sounds like a good idea, but you've got to do this, and you've got to do this, and you've got to do this, and you've got to do that, and you can't exclude this person, you can't do this, and you can't do that," whatever. So they're caught in this web all of a sudden. So now, because of what's commonly called now, I guess you can just go ahead and say it's called Obamacare.
Yeah.
And there's another name. It's called the Affordable Care Act, but I don't think anyone uses that anymore. They just say Obamacare. but that's changed the territory, and now the companies all of a sudden are trying to figure out how they can extract themselves out of that, pull themselves away, and a lot of people warned them to say, look, once you get in bed with the government, you're messed up. And United Healthcare now wants to get out of Obamacare. So
right.
And Humana and Blue Cross, a lot of them.
How many have already bailed on us? I mean, there's probably has to be quite
about
a few.
3 or 4. Yeah, 3 or 4 of the big ones.
Wow.
Is that even legal? I mean, can they legally do that?
Sure
Opt out?
I mean, they don't have to participate in a certain program, do they?
Well, what they've done is they haven't bailed out. They just said, look, we can't go on with this. We've got to figure a way. We're even with all of these restrictions, we can't do it because the insurance industry itself, if you think about insurance, it doesn't make sense. If I were to tell someone, don't buy car insurance, just wait till you have a wreck, and then you can run down and buy some insurance and take care of it. So
it doesn't work that way.
So we've told people, that hey, there's no you don't have to have pre-existing conditions, and then and the insurance company says, what? So you mean we can enroll anybody? You have to enroll anybody at any? Yeah, you can't honor. You have to take everybody. You can't. And so the people on the other side say, sounds like a pretty good deal. Since there are no pre-existing conditions, I'll just wait until I get one pre-existing condition, and then I'll get me some insurance. I'm not going to pay those high premiums.
Yeah.
Interesting.
So
Doesn't work that way.
it's part,
Well,
it's part psychology, and it's part.
and the theory in total was that if everybody helped pay for it, everybody contributed to the program, paid the high premiums, then the few that got sick would be taken care of, and the insurance companies would balance that out, right?
Mm-hmm. Mm-hmm.
Well, and what we found out is that's not necessarily the way it's been working out.
I have a friend that does what we call, it's called underage. Anybody under 65 is underage. So we look down our nose at those people.
I'm underage. Weird.
You're underage.
I haven't been carded in a while, though.
So anybody under 65 is what we call underage. So at any rate, I have this client, and he's in charge of his grandson, and his grandson he's adopted his grandson, and so he's trying to raise him like he was raised and so forth. And he told him, look, you got to have medical insurance. I'm on Medicare myself. So we've got to do something about some medical insurance for you. So he's been after me about it. And I said, okay, I have somebody who does that. So I took this person over there to their house, and this young guy, he's in college. He goes to like San Jacinto College, and he's trying, he's working every year. You know what happens. He's 19, 20, something, 20, 21 maybe. I don't know. But he's looking at that, and it goes, he's sitting at the table, and his eyes get this big, and he said, it cost how much? $175 a month. And his granddad said, you've got to find a way to pay for it.
Exactly.
Because I don't want you out there walking around in society without health insurance. And so he finally relinquished it. So as far as I know, the young man is paying the premiums, but he really didn't want to.
Well, yeah.
And somebody had come and says, look, you can always apply for this insurance. There's no such thing as pre-existing conditions. So insurance company by law has to take you. So why do you want to get on it?
Yeah.
Why do and from their standpoint, but what it does is it bends the system, you see. So now the healthcare company is not bringing in the premiums necessary to take care of all of the claims. So they're losing money, and the government has said that they'll make up the difference. Kind of lagging behind, way behind, because all of that stuff has to go through Congress and yada yada yada. It's all mixed up. But anyway, fortunately for over 65, Medicare has been in existence since 1965. So it's different, and you've got your underage, and so we're not bothered so much by the Affordable Care Act, to use the exact term.
Yeah. Hey, Steve, it seems like tonight, I don't know if you can hear us, but it seems like your internet signal is getting a little weaker than it has been in the past. And you dropped off on Tuesday night, and I wondered if there was an opportunity that you may need to restart your router or something in your service has changed. I don't know if it's, but
it's possible. I still have the same service. So I don't know. Yeah, I noticed Tuesday night that everybody was garbled. I don't know if any was anyone else having
No,
problems.
it was all on your side, and then you dropped off.
So,
It was.
Yeah, so you might want to restart your equipment there when we get off
yeah.
this call.
I reboot my computer and my router once in a while, Steve.
Oh, really? Okay. Yeah, I can do that.
There you're back.
Yeah, because there he's back now.
I'm back now.
It happens. I mean, actually, the US,
I was like, man, I'm not, and I went off and came back 2 or 3 times, and I never.
you could never reconnect. It was like, okay, you're coming. It's Steve's almost here. It's like he can make it.
Yeah.
And it just couldn't quite connect to us. So
yeah.
You know what I find really funny or interesting, or ironic, I guess, I don't know, depending on how you look at it, is the U.S. is not even in the top 10 countries in the world with fast internet. I mean,
Really?
No, we're not. I don't even think we're in the top 20 anymore.
What?
Yeah. There's countries that have much faster internet than we do.
I thought we were like always number one for everything.
No, not even in the top 20. No, I think South Korea.
Not just in insurance, but in internet, but quite a few things.
I'm gonna try to guess who's number one.
All right.
Let's see if I guess correctly. Okay. Japan.
Nope.
Nope.
Not the last time I checked. Nope.
Really?
South Korea.
South Korea.
Yep. What?
Yeah.
South Korea.
That makes no sense.
Why not? I mean, if they're building infrastructure and they build it faster, I mean, South Korea makes some amazing products. I mean, they have a lot of, electronics. They have a lot of development and a lot of brilliant engineers there. So they have.
I've always been told that USA was number one in everything, so I'm feeling a little uncomfortable right now.
I'm sorry to burst your bubble. That's just not the case.
Insurance.
Yeah.
Healthcare. We got to be number one here. What's up with that? We got to get with it.
So, Steve, who has the best, most comprehensive, cost-effective insurance around the world as far as healthcare? Have you ever tracked that or identified that in your travels?
Well, I do know, I do quite a bit of reading about, in 1948, Britain established, I think there's 3 initials for it. I'm going to say it's HSA or something like that. I may be wrong. In 1948, and it was a governmental group, and I've heard and read the stories, forever about it, and the length of a wait period for, let's say, knee replacement or whatever is like 2 years, something like that. And sometimes the same is true of Canada. Canada has a program like that, and the government programs just don't seem to work as well at all. It's just, it's just the way it is. I don't know what the life expectancy is in Britain as opposed to anywhere else in the world. It may be higher. I don't know. There are places, of course, in the world that have next to no health care.
Yeah.
Just nothing.
I would think Norwegian countries, Sweden, Norway, they might have. I think they're more of a socialist coverage, aren't they? Scandinavian countries. I don't know. I mean,
I think so.
I think that might be the case. Well, that one gentleman's a little in trouble from the Panama Papers, though. Apparently, he had a little bit of money over there.
Oh,
got in a little trouble.
Oh, really?
Yeah, one of the officials, the government officials of a Scandinavian country, When Panama released some of the financial statements for people who were storing money offshore, he was listed as one of the people who was saving money offshore to avoid taxes. Yeah.
Oh, really?
So, his country didn't take too kindly to that, apparently.
Oh, I bet.
Are you trying to say that people aren't perfect?
I have said that from day one, and I'm first in line to say that about myself, because it's like I can't cast the first stone, because it's like, okay, everybody has their faults. It's like, holy cow. Sometimes when they get caught, though, it makes a big impact on everybody's life. So.
Sure. Yeah.
So healthcare in the U.S., do you see it changing or evolving or shifting back after the political?
Oh, good question.
Every term and every presidency has their actions and activities, and I think that's a big rock to move back in another direction. I don't know.
We swung pretty fast, pretty hard with Obamacare. Don't you think we could swing back again pretty fast?
Yeah, we could, and I guess some of the people running for presidents, and maybe all of them on one side, said the first thing I'm going to do is abolish Obamacare.
Yeah,
but I don't
know.
Some of the states refuse to participate in establishing what's called those groups or those exchanges. They call them exchanges.
Right.
So the government came in and said, if you won't do the exchanges, then we'll do it for you. And so it was written in the law that all the exchanges have to go through the states. Well, what they failed to do is ask the governors about that. And the
governors are saying, I don't want that financial burden in my books, right? I mean, realistically, that's
I don't think we have to do anything, sir. Us next time. You should check with us.
Russ, I'd like to know if the type of doctor that represents you would be somebody that Medicare would cover. Could you explain that to Steve and ask him about that?
The type of doctor?
Yeah, like you pay one fee and you get to see him anytime you want.
Oh, like the concierge plan.
Yes.
Yeah.
Concierge plan.
Yeah. So, I would anticipate that a portion of that would be covered under the plan. Depending on the coverage, it all boils down, as I understand it, Steve, is it all boils down to the codes that they use for processing Medicare. If you're in the program and accepting Medicare coverage, and this is what I picked up from you earlier, Steve, and if you want to go back to some other episodes, you can check out other episodes. However, when you're in the Medicare program, the doctor is either in the program or out of the program, right? Is there a part way in, or is it halfway in, or I don't think there's. You either accept Medicare or you don't accept Medicare, right?
Uh-oh.
Did we lose our expert?
Yeah. Well.
Yep.
Can you hear me? Okay. Well, the concierge plan, that you're talking about, there are a lot of physicians are saying.
Oops.
Now, whether they can, I'm tired of it. I just don't want to deal with it anymore. I just, I just want to work outside of the system, and for one fee, I will take care of everybody. And that's good, except that when one of your patients has to go to the hospital, and now all of a sudden you're having to be drugged back into it because the hospital is just replete with people, or filled with people that are part of the system.
Mm-hmm.
So what do you do if your patient has to have an X-ray?
Right.
Well, somebody's got to pay the radiologist to read the X-ray.
Right.
Somebody's got to have the specialist to take care of the whatever the blood issues are with that, all of that sort of stuff. So I always felt that it's kind of unrealistic for someone just to jump out and say, okay, I'm a doctor, so you come to me and that's fine. Well, suppose the doctor finds something seriously wrong, then what?
Yeah.
So, I mean,
well, there's no pre-existing condition, so the doctor just says, hey, go get some insurance. But doesn't the doctor have to recommend radiologists? Doesn't the doctor have to send them to the hospital? Or there's a process?
Yeah, that's what I'm saying. So when you go to the hospital by definition, because they accept federal funds, they have to be totally involved with whatever system is out
Got
there. All of them are in. They accept federal funds in one form or another. All of them do.
Right.
And so it's all intertwined, and it's to untangle it all. And and I've heard this before about the concierge physicians, and I've wondered myself how that would work in case of a major diagnosis. If you've got a cold, or you could put a few stitches in the side of your face where you had an accident or something. That's one thing, but
right.
If you've got major problems, you've got extreme dizziness all of the time, and now we're talking about some major exams and tests and so forth to find out what's going on inside someone's skull. That's
Right.
where all the costs start then.
The testing.
The testing and all that.
Yeah, and treatment of major, like you said, the treatments for, did you call it photon?
Yeah.
Proton.
Yeah.
Proton.
Yeah. Sounds like a war.
Yeah, it does. But apparently they're really good. I mean, they're
We're against cancer.
Yeah.
Yeah.
That's true.
Yeah. Well, the
But
other thing I think is interesting, Steve, is the fact that there's so many people that are still not getting the kind of coverage that we could actually, I think, deliver in some respects with technology. I saw a device the other day that it was online, and they're getting to the point where they're actually doing a scan of food or vegetables or.
Oh, I saw that.
Yeah, and they're collecting all the data on this, so we can get analytics on all of this information about the food we're eating, the cause and effects, and the medication, and all of these chemical compounds combinations, and it's going to go into a huge database. And I think at some point in time, somehow, when they have enough information, just like they did with the DNA sequence, they anticipated it was going to take decades to do that, and they did it in a few years because technology had kept accelerating. And I suspect, a lot of the cause and effect around our health is around, what we eat, how we eat it, and several other contributing factors, right? So it's, we're just on the tip of the iceberg, I think, with what we're learning about healthcare and some of the things that we need to do with our bodies and and the sciences. So
yeah. I saw the same thing. I saw that article about that, and I was thinking, oh, that's really great. The thing about it is they put that device next to a watermelon, and they get a certain kind of vibes or information or whatever, and then they put it next to a lemon, and they go, oh, it's more healthy to eat a lemon than it's a watermelon. So do I eat a lemon or a watermelon? I think I'll just eat both. I don't know. I don't know. But the three of us know a gentleman by the name of Red O'Loughlin who he's written a book about that, and it's a good book, and it reveals a whole lot of things about living longer. You know, the strange thing about this is that the longer you live, the longer you want to live, kind of thing, and it's all comes down to we're all going to die sometime, for sure. So, at least in our lifetime, anyway, that's going to happen. So it's you know, I don't who knows, but I agree that diet has a lot to do with it.
Oh my goodness, yeah, and you don't even start thinking about that until you start getting ill from the food or from lack of exercise. And
well, I'll tell you what, you mentioned that, and everybody, the older you get, the faster it goes. I mean, this week I mean, the weeks and the months and the years go by so quickly, Steve, and I'm sure you could feel the same way. It's like, how is it possibly, May already? I cannot.
Yeah, the middle of May, not just even the 1st of May. It's the middle of May.
Yeah.
Yeah, and June is bearing down on us.
It's insane.
I feel it when I walk outside.
Half the year. Yeah. Half the year's gone.
Well, this has been a
great conversation, Steve.
Yes. I enjoy it so much. I learned so much from you, Steve.
I really appreciate these talks we have in the afternoons on Thursday. Every Thursday.
Yeah.
So, big plans for the weekend?
Well, I'll probably do a lot of work, actually.
I think that's what I'm going to do. I'm going to.
Yeah, I know you guys. I know what you guys are going to do.
We definitely enjoy what we do, so it makes it much easier than if we hated it, right?
Yeah. Yeah, you seem to be everywhere.
Hey, we're everywhere. Did you hear that?
Yeah, we're everywhere. And now, I notice different people connecting with us. Do you notice that, Marion?
Yes.
Yeah.
Totally different from 6 months ago. It's
totally it just seems like there's more people that want to connect with us and getting responsive and responding to all those people. It's a different conversation. So.
That's right.
Yeah. So the Future Media Association now has a personality of its own.
Pretty much.
It's moving.
It's sort of.
It's alive.
It is alive. It is alive. Even nothing happens overnight. However, we just keep moving forward. We'll be doing okay. So.
That's right.
That's why I look at it.
Yeah. Well, I miss hanging out with you, Steve. Right. It's been good to see you tonight.
Yeah, fun. It was fun.
I brag about you all the time. I tell people about what you're doing and some of the things that you're doing. I cannot believe it. 67 people in 4 hours conversation. That's pretty good.
Yeah, as soon as you stop the recording, I have a couple things I want to talk about.
Okay.
Cool.
Good.
Well, we can wrap up the show. I just want to make sure that we, share healthcare peace of mind with Steve Baker. I'm Russ Johns, and my lovely co-host Marion LaSalle and I. We do everything we can at Future Media TV. And Steve, as always, it's a pleasure to learn a little bit more about healthcare and what we need to be aware of. And I just really thank you for all the work you're doing out in the public and the community and helping people with their coverage and getting the care they need. So thank you so much. And we'll see you next time, next Thursday.
Bye.
Next Thursday.
Bye.